Hi, I'm Dionne and I'll be presenting our work on user perspectives and ethical experiences of apps for depression. Co-authors for this study include Corina, Sandra Sünram-Lea, and Heather Iles-Smith. So in terms of looking at the literature in this area, there's been much discussion on the ethics of mobile mental health, and that includes apps for depression, yet gaps still remain. And so for us, a key motivation was really looking to amplify the user voice in this discussion and to capture their unique experiences of ethical issues in apps for depression. In doing so, we focus specifically on depression, given the high prevalence of depression and its associated burden of disease. We also were motivated to advance the discussion on the design of ethical apps for depression. So with that in mind, we had three key aims. Firstly, to capture users' experiences of apps for depression, to identify elements of ethically designed apps for depression, and to present implications for ethically informed design. So just to go through quickly our study. So our study builds on a previous content analysis that we did of apps for depression in the commercial app marketplace. And so for that study, we searched Google Play and Apple App Store for apps for depression and found 353 unique apps. For the present study, we sampled 40 of those apps, specifically looking at the most rated and the lowest rated apps for depression. And then it's from these 40 apps that we sampled our user reviews, with over 2,000 user reviews included in our thematic analysis. So the key findings related to user perspectives and ethical experiences are grouped under these four overarching themes. So firstly, many user reviews spoke of benefits and harms of apps for depression. So there were a range of benefits experienced by users from using apps for depression, but there were also potential risks and adverse effects. So when we speak of risk, we speak of the potential for harm. And this was seen, for example, with inadequate or inappropriate advice given by in-app support, and also misdiagnosis due to incorrect data collection or reporting of data. And then for some users, they reported actual harms or adverse effects. For example, some users reported feeling worse after using the app, and others reported instances of harassment or bullying by in-app support, particularly in peer support communities. This related to the second theme, which spoke of facilitators of benefits or harms. And for this theme, we consider technical features that are not traditionally considered ethical concepts, but within the context of user reviews, really showed the potential to either increase benefits or to increase risks or harms. And so these related to ideas of usability, design of the app or design of the intervention, and support. For example, for an app that had poor usability or app instability, this would affect the delivery of the intervention and therefore would potentially prevent users from accessing the support that they needed and discontinuation of care. The third theme looked at justice and rights, and under this were concepts of autonomy, access, commerce, privacy, and respect. So user reviews showed that apps for depression really had the potential to increase user autonomy and to also increase access to care, particularly through the reduction of barriers to traditional mental health care. Yet for some users, they reported that apps actually introduce additional barriers to care, particularly through high app costs and a lack of transparent pricing models. For some, this meant that they had difficulty accessing the care they needed, and this also led to a reduction in trust in the apps. So trust and ideas of transparency were then found in the final theme, which related to the virtue. And this dealt with ideas of moral good or social good of the apps, and also the app's intentions or motives. So for users who had negative experiences of using apps for depression, particularly related to costs or a lack of transparency in commercial models, they had a lack of trust in the apps and also tended to believe that developers had negative intentions, with some even describing them as seeking to exploit vulnerable people for financial gain. We then used these overarching themes and the concepts within to develop these 14 elements of ethically designed apps for depression. And we intend the elements to be considered as heuristics, really just to kind of be a foundation in considering the ethical design of apps for depression. To then structure our implications for design slightly more, we frame and integrate our elements for ethical apps for depression within existing dimensions from frameworks such as the principles of biomedical ethics and also virtue ethics. So in the paper, we frame and structure this discussion under 5 principles, but I'll only discuss 3 in this presentation. So the first of these principles deals with non-maleficence, that is designing to avoid harm. As we saw previously, there was risks and associated harms with elements of in-app and peer support, and therefore it's important that apps for depression carefully consider the sources of support that users need and how to deliver the support safely with safeguarding and monitoring in place. There's also a need to align the source of support with the stage of depression and the stage in the treatment, and to really involve users in this design process to ensure that the support that they receive aligns with their needs. Related to this is then needs related to the continuous monitoring of negative emotions through tracking and monitoring. So tracking and monitoring of symptoms, or for example, moods and thoughts, is a key element of many interventions of apps for depression. But for some users, they found that it really triggered rumination of these negative thoughts and feelings. And so we therefore encourage incorporating elements of compassion and acceptance and mindfulness in the design of these tools, so that there's not a great focus on kind of negative thoughts and negative feelings without the necessary support. The second principle we looked at is justice, and this really related to designing for fairness. And this was a key theme that came through in terms of access to care. And when we talk about considering how to design to mitigate issues with access and barriers, it's not just about designing the app or the intervention itself, but really the place of the app within the healthcare system or within the app marketplace. And so how do we then ensure not just access, but fairer business models that include users in decisions on the cost of the apps and also the commodification of their health data? So an additional component to this has to do with designing for accessibility, and not just accessibility in terms of designing for other disabilities that people with depression may have, for example, visual impairments, but really also designing for the specific needs of a person with depression and what they might need for an app to help them to complete the intervention in the way that they need to get the benefits. And finally, we consider virtue, that is designing for moral good. And so under this, it really has to do with transparency and the need that apps for depression are marketed and designed with transparency of all elements, so that users can have trust in the app and the information given to them. This relates to ideas of fidelity, that the app is truthful and it does what it says it will do, and therefore the intention behind the app, so that users know that the developers or the app is intending to give them care and to provide them with care, and that is the main intention, so they can trust the app and the level of support that they're given. Thank you for listening. Please get in touch if you have any questions.